Assalamu alaikum. My name is Hamza Irshad, roll number 16500886, and my topic is chlorine based compound. Here is my agenda, and I'm starting with the introduction. Chlorine based compounds are basically known as chlorine releasing compound, and they are belonging to a family of chemicals that possess or can produce OC-1 or ROC1 in solution. Chlorine is a strong oxidizing agent and the third most electronegative element. Specific compounds in this family include sodium hypochlorite, monochloramine, halazone, chlorine dioxide, and sodium dichloroisocyanurate. Now, moving forward to the indications. Um, it is used as disinfection of medical devices, instrument, linen, floors, and surface. And the therapeutic action is it is used as disinfectant, and they are also used to make PVC. This plastic is used in windows, window frame, car interiors, electrical wiring insulation, and water pipes. It is used as an oxidizing agent and in substitution reaction. Chlorine was commonly used to make chloroform, which is an anesthetic, and carbon tetrachloride, which is a dry cleaning solvent. Dose administration: orally, calcium hypochlorite has an oral LD50 of 850 mg per kg of body weight. Parenteral is ammonium chloride, adult and pediatric dosage form and strength. The injectable solution is 5 milliequivalent per ml, and the second is injectable solution of 1 mg per ml. Pregnant general intake is um, 425 mg per day for female and 450 mg per day for pregnant female. Now moving forward to uses of compound. Rational use of drug. Chlorine compound used as disinfectant in swimming pools can lead to the formation of irritants responsible for eye and upper respiratory tract irritation experienced by pool attendants and lifeguards. Irrational use of drug. Drug produced with chlorine chemistry are used to treat many medical conditions and diseases, including high cholesterol, diabetes, cancer, stomach ulcer, anemia, depression, asthma, high blood pressure, inflammation, and epilepsy. Mechanism of action. So chlorine compounds are used for disinfection process because for they are strong oxidizing agent. Action of chlorine can be explained through the following mechanisms. First one is cell wall destruction that result in cell lysis and death. Chlorine hydrolyzes the cell and causing mechanical disruption. The second is cell permeability alteration. Chlorine alters the cell wall permeability, resulting in lethal damage to the cell. And the third is inhibition of enzyme activity by strong oxidizing agent and altering the enzyme's chemical properties. The adverse effects. So the first is breathing small amount of chlorine for short period of time adversely affect the human respiratory system. The second is effect differs from coughing and chest pain to water retention in the lungs. And chlorine also irritate the skin, eyes, and the respiratory system. Toxicity. Many chlorinated compounds are toxic for man and animals. Their genotoxicity, mutagenicity, and carcinogenicity plays a role in risk assessment. More and more chlorinated organic compounds are being shown to be carcinogenic. And drug-drug interaction, it interacts with calcium chloride, which is an ionic compound used for the treatment of hypocalcemia and hyperkalemia, and as an antidote to magnesium intoxication due to overdosage of magnesium sulfate. Some drugs that may interact with chlorine are mefloquine and penicillin, and there are many more. Different brands of chlorine: Zyprexa, Celebrex, Neurotin, Epogen. This is a case study. The case study says chlorination at plant and drinking water quality. A case study of different sectors of Islamabad, Pakistan. In the city of Islamabad, drinking water quality, quality the treatment plant usually meets the country's hygienic standards to provide protection against recommendation concentration of total residual chlorine in treated water is maintained at level from 0.2 to 0.5 mg per liter in tap water of consumer and rechlorination is not practiced. Some areas of the city have very low residual chlorine at consumer uh, taps and little production against secondary microbial contamination of water in pipeline. The analysis of the drinking water quality in the distribution network was carried out during March to August in 2008 by collecting 80 water samples in triplicate from treatment plant and remaining of the residential taps. The collected samples were examined for total chlorine, free chlorine residual, chloramines, trihalomethanes, total organic carbon, total coliforms, fecal coliform, and turbidity. The water sample collected from sector F6, F10, and F11 were found to be free of fecal contamination, while in sector E7 and F7 contamination were found at few stations among all the collected samples. Water sample collected from sector F8, G9, and G8, I9, and I8 were highly contaminated with E. coli. At most of the sampling stations, trihalomethanes and chloroform were detected at high concentration in sector F8. Soap note: subjective. Age of the patient is 23 years and the gender is male. Chief complaints: upper abdominal pain, heartburn, nausea, and sometimes vomiting. Patient is, however, non-alcoholic and non-smoker. Past medical history is he had a family history of peptic ulcer disease. Current medication is Simplex, naproxen to relieve pain from past 2 days, but no significant effect. The objective is weight is 58 kg, height is 5 feet 8 inches, BMI is 19.44 kg per meter square, temperature is 98 degree Fahrenheit, and BB is quite normal. Diagnosis: according to the provided information, patient's lab tests were done. There were no signs of bleeding as HB values were normal, which is 13.5 gram per dl, and absence of blood in stool and vomiting. Serological and urea breath tests confirm H. pylori positive infected in the patient. The plan is three types of intervention after reviewing the patient history and physician prescription. Medication plan: amoxicillin 1 gram twice daily, Clarithromycin, which is clarithromycin 250 mg twice daily, risomeprazole 40 mg once daily, Glamade, ranitidine, aluminum hydroxide 150 mg twice daily, and mucin suspension, which is magnesium hydroxide, oxythazine 120 ml 1 tablespoon thrice daily. Patient counseling: take omeprazole before meal. There is no need of ranitidine H2, which is H2 receptor antagonist at this stage of patient. Triple drug therapy is followed in the patient as PPIs and mucin syrup is already added and in medication to relieve burning sensation. So Glamit is skipped from therapy. Dietary modification: omega-3 polyunsaturated fatty acids should be added as they have an anti-inflammatory effect and protect stomach from ulcer. Avoid spicy food and late night meals. Take healthy balanced diet and low, which is having low cholesterol, and take plenty of water and fresh juices. Lifestyle modification include avoid lying down in bed immediately after meal, elevate head of bed, avoid stress. Outcome is patient used the medicine regularly. Routine test and monitoring was done and patient was improved on follow-up. He was advised to visit in case of any complication. These are the references and thank you.